Hi there. My name is Dr. Marcy Zwelling, and I'd like to talk to you tonight about the Ebola virus. I'm going to say some pretty provocative things, so please listen carefully. Obviously, the Ebola virus is a crisis, a tragedy for those who are afflicted. It has been killing about 50%. The good news is that this is down from the before 90% mortality. We don't know why that is. Perhaps some of these people have been getting better care. That said, our country, I think, is shameful in our handling of the Ebola virus. First of all, I am a proponent of quarantine and not allowing anybody from the countries of New Guinea, Liberia, or Sierra Leone to come into this country. We can track that. Passports have the route of transfer, and we know where these people come from, even if their last leg of their airplane flight is from a European country. They should not be allowed in this country unless they want to go through a quarantine of 21 days. If we want to set that up in this country, I think we can, but no one should be allowed in this country who could have the slightest chance of giving anyone here Ebola. Secondly, I think that it's a shame what happened in the Dallas emergency room, and this is where this gets a little bit provocative. I'd suggest to you this is a failure of Obamacare. Let me explain. Obamacare is a system that deals with population-based health care. The doctor in that emergency room and the nurse were behind computers. They were busily putting in data that had no relevance to the patient's needs and management at that time. And quite frankly, this is what happens over and over again in our hospitals and sometimes in our doctors' offices. In order to get reimbursed adequately, doctors have become robots behind a computer, filling in blanks, filling out boxes, check, 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 so that they can get paid. We're not listening to patients, and we're not talking to each other. The key to better health care is the transfer of salient information, good data, a discussion of what we can do about our patients. And my feeling that had that emergency room in Dallas had good communication practices, had that nurse said to the doctor, "Doctor, we have a patient here with a fever and flu-like symptoms who flew in from Liberia," because the patient did give that information. The patient would have been quarantined on the first visit, but that information was not transferred. Indeed, it was put into a computer system, but the computer system is an abyss. It is a hollow vacuum of information that goes nowhere except, of course, to the government for their purposes. It is not legitimate communication, a communication tool. It is the wrong utility to take better care of patients. Doctors need to start talking about what we need to do to improve our care through better communication as opposed to reimbursement through useless data. That's my opinion for the day. It's 2014, October 7th, mark it down. I say we get rid of the EMR as our utility for computer-based medical record keeping. It doesn't work. In the meantime, I wish all those who do have Ebola in Africa, and of course those who have contracted it here in the United States, who are under care to get better. That obviously is our goal at this time. And I'd like you to think about this and tell me what you think. Thank you so much for listening. Have a wonderful week. Bye-bye now.